We're going to start by talking about the value of linking administrative data. And then data linkage is an important tool in research, the value there, and then the responsibility that comes with that tool. And we're taking a privacy angle on that. And then we're going to talk about what's happening around privacy, data, and data linkage and HDRN Canada. So just quick overview, we're going to define, talk about the benefits, risks and considerations, the governance approaches, and this is where we're coming at today from the privacy angle, HDRN Canada's initiatives that are really important and that are happening, and how the privacy team is trying to support those initiatives. So with that, I'm going to turn things over to Michelle to get us set up to talk about the data linkage.
Right. Well, good morning for some and good afternoon for others. Thanks, Donna, for the segue on that one. So I'm going to start by saying that for the purpose of providing a baseline for this presentation in particular, we've examined many definitions of record or data linkage, that we're going to call it for this presentation because it's called many other things, across many organizations. So you will note in the slides that the definitions are very similar with some variance in language, but not in meaning. And in essence, all the definitions that are there talk about combining information about an individual. So if we can go to the next slide, please, Donna. Okay. So without going in the depth of the subject, here are some examples of data linkage techniques. So let's start with statistical linkage box that is right there, which means to understand patterns and relationships between data from various data sets. It allows us to determine if the records in different data sets are about the same individual. It looks at the relationship of the record instead of looking at the record itself. So R and Python are really instrumental in performing this type of determination. With regards to matching linkage, which this type of linkage relates to exact matching, meaning that you ask yourself, is the record really about me? Which can either be deterministic, meaning that there's an exact match between the records, that we can confirm that it is me, or probabilistic, meaning that even if the data may vary, the data itself is likely a match. There's a likelihood of being the same entity or the same person. So those are the types of linkage that can take place. Next slide, please. So in today's world, data is everywhere, and when linked effectively, it can unlock the world of possibilities that could otherwise remain untapped. So I'll touch a few of the benefits of doing data linkage, such as improving data quality. Linking across multiple sources will highlight inconsistencies between data sets that can then be corrected, leading to more reliable data. As well as data gaps, linking data allows us to fill in gaps that exist in an individual data set. One data set often does not hold sufficient information to provide a full picture about an individual of what is really needed. Cost effectiveness, it allows us to leverage existing data across various systems or data holdings, thus reducing the need to collect more information, reducing the burden of collection. Another benefit is increasing research efficiencies by eliminating redundant processes, improving data consistency. It allows for the centralization of data sets, like the creation of really robust workflows to focus on analysis and not so much on the collection of the data. It also, we create more accurate and complete data sets by linking. By combining various data sources of data, we offer a broader perspective. We fill in gaps, we uncover hidden patterns, we complete data sets that are isolated from other data. Data linkage allows us for the scope of research to expand and to introduce interdisciplinary research to interconnect data. It allows that world of possibility I was mentioning at the beginning. It also allows us to enhance predictive models and to provide real-time insight. Another benefit is with the right technology, it allows us to link sensitive data that otherwise we would not have been able to link because it would be considered too sensitive to use. So some techniques allows us to do this. But the resulting benefits of data linkage are in essence inexplicable, but I will try. So the big picture and the benefits of this is really is that helps us enhance, helps. It does enhance decision making. Better data helps us make better decisions. It improves policies and programs. It makes them more effective, more relevant, better service delivery. In terms of research, we understand our subjects better, therefore, we can conduct better research. Stronger collaboration, the new data sets can benefit other stakeholders, and it increases innovation. It creates opportunities to develop new data sets and researching topics previously out of reach. So far, we've looked at what is linkage, what type of linkage, the benefits of data linkage, but now let's have a look at how it really works. Okay. So the following two slides that we're going to see, we'll start with this one, demonstrates two ways to link records about an individual. The first example is about linking information about one individual amongst many sources of information about that same individual. So think about yourself and where your information is held presently. It could be either in your workplace, it could be in a hospital setting, it could be with Canada Revenue Agency as tax season is coming upon us, etc. So that is information about you. It makes your this is how you're knitted, if you want. So, in the context of health research, this type of linkage provides for a complete health picture of an individual. However, it is considered very privacy intrusive. As we are creating an identity, the French in me is coming out slowly, identity for an individual. Hence, the importance of applying strong privacy controls when we undertake such a linkage. And we will see those controls a little further down in a few slides. The next example, go to the next one, Donna, please. Thank you. The example on this page, it really shows another type of linkage. It's about one individual, but over a period of time. Therefore, the data linkage may happen from the same data set, for example, your hospital record or visits, but it will offer a picture of your healthcare continuum over time for yourself or that specific individual. It is also considered very privacy intrusive as it divulges specific information about the health of an individual. So, however, and in this case, it is more specific than the previous example I had provided. So in the next couple of slides, we describe examples of linkages and their purposes, but I'm just going to talk about specifically two of them. The first one was provided to us by Health Data in Nova Scotia. So it relates to a project that involved many different linkages to external data sets, including registration data from both Nova Scotia Health as well as IWK, which is a women's and children's hospital. The Nova Scotia Health Emergency Department data, as well as the Diabetes Care Program and the Juvenile Idiopathic Arthritis clinical data. So it described and compared the patterns of healthcare utilization before and after transfer from pediatric to adult care in youth that had inflammatory bowel disease, as well as juvenile idiopathic arthritis, cystic fibrosis, and diabetes. They were able to identify predictor of care transfer outcomes such as age of diagnosis, continuity of primary care, and area of residence. So in order to build a local model and system for really supporting the patients that are transferring to adult care, they identified the need to do this background and to understand really the scope of what the issues are before they could develop a strategy on addressing those issues. So therefore, this record linkage was demonstrated as having a huge public benefit. The second example in the next page, please, Anna. So this is a linkage done by Statistics Canada. It is a linkage of the Canadian Cancer Registry to administrative data on child and mother to explore outcomes among pediatric cancer patients. The purpose of the study was really to evaluate the relationship between pollutant exposures during pregnancy and childhood, as well as pediatric cancer incidence. It uses two data sets. It uses the vital statistics birth data, as well as the Canadian Cancer Registry. The study would likely not have been possible without using data linkage in this case, because the collection would have been nearly impossible to do, or if it had been, the quality would have been so low that the data would have been unusable. Therefore, not only would it demonstrate a public benefit, but it demonstrated that there was no other way to do so. So those are two examples of where a record linkage really assisted research. So now let's talk about the risk to data linkage that we talked about how great it is. Let's talk about what are the risks that come with it. One way to approach the risk associated with data linkage is to consider the 5 SAFEs framework. For those that are not familiar with the 5 SAFEs framework, they are stated here. So safe data, safe projects, safe people, safe spaces, and safe outputs. They are categorized this way, and by we're looking at the risk in those categories, it really helps us ensuring that we have a comprehensive views of what record linkage risks are in relation to privacy. So I'm going to go through each of them. Safe data. This one refers to the way that we treat data to minimize the threat to the privacy and confidentiality of individuals. So techniques such as data anonymization, pseudonymization should be used to reduce the risk of re-identification. Techniques that we likely all know about. Data encryption prevents other types of risks such as unauthorized access. Safe data includes also the aspect of using data that is accurate, complete, reliable to produce really good quality data. So it's not just about keeping the data set from being used incorrectly, but having good data. In fact, it also includes the fact that sensitivity of data is an important aspect and consideration when we look at safe data. In 2012, the Office of the Privacy Commissioner actually, not the Privacy Commissioner, I'm going to take back. In 2012, there was a federal court decision that actually stated and acknowledged that medical information is very sensitive and it should be protected in a manner that is commensurate with its sensitivity. Therefore, demonstrating the need to organization to deal with data, especially medical data, in the way that recognizes its sensitivity. The next safe projects, this refers to how the data linkage is conducted, meaning that is it conducted in an ethical manner, in a compliant manner. This may also refer to the fact that there could be an RAB proposal, a data linkage authorization, or other legal authorizations that are maybe requested by an organization. It's about having a sober look at what is going on and do we have the authority? Do we look at public benefits and other aspects that Donna's going to talk about in governance? This SAFE really addresses another important social concern that according to a survey done in 2020 by the Office of the Privacy Commissioner, the majority of Canadians felt that they did not have very much or almost no control over their personal information when it is used by companies or by government. In fact, up to 65% of Canadians stated that, which demonstrate to us that there's an obligation on organizations to ensure that they do offer some type of control or demonstrate themselves that the data is under a clear control when used. Next, safe people. This refers to the who is authorized to access the data to undertake the linkage. The data should only be accessed by individuals authorized to do so and are trained to use that data. That would be the first look at when using that data. Access control should be in place as well as auditing, monitoring mechanism that will further protect that data to determine whether it was properly used. And as well as safe spaces means that it focuses on the environment in which the data is being linked, whether the environment is physical or virtual. And there should always be some strict security measures in place to protect information from unauthorized access. Restricted physical spaces, firewalls, and encryption tools should always be in place. And finally, safe outputs. This really refers to the results of the data linkage. It is crucial to ensure that the output does not disclose information that could identify an individual. The aggregation of data is a method that will really address this risk. There's other methods, but this is the main method that is used for safe outputs. So now that I've talked about how to save data, I'm going to pass it on to Donna. We'll discuss the governance approach to data linkage. Thank you.
Thank you, Michelle. Okay, so what we're sort of leading up to is this amazing capacity of data linkage. And I know folks at HDRN Canada, you guys this is part of our raison d'etre, it's what we do. And so how do we govern that? All these important things that Michelle was talking about, how do we look after it? Well, we use one of the governance approaches is to use safeguards. And there's a lot of safeguards that we follow, and a lot you might know them as safeguards, or you might not. They might be things that you just do or follow processes you follow, and you don't even realize there's safeguards. So, from an administrative point of view, safeguards are things like the requirements or regulations that actually come out of legislation, whether it's federal, provincial, or territorial. And then we often interpret that legislation or follow the guidance from our ombuds or privacy commissioners in our regions. And we will have our centers, or as data stewards, we'll have policies and procedures that are followed. Those are administrative tools and safeguards. We have privacy training requirements. That's an administrative safeguard. And then we have, confidentiality agreements and data access agreements and data sharing agreements, all administrative tools. Impact assessments. Many regions require every data project, data access request around linkage, or has an actual privacy impact assessment that's completed prior to approval. And then just documenting how data linkage happens. These are all making that clear and transparent. These are all pieces of all pieces of administrative safeguards. We also have physical safeguards, and these are the ones that speak to having that, mechanisms in place for actually securing the physical access of data. And those are going to be more your alarm systems, multi-factor authentication, having your phone so that I don't know about you, but I can't even get into my workspace in the morning without turning my phone on, kind of thing. So locked doors and pass keys, firewalls, these are physical tools. But we also have technical safeguards. And these would be things like multi-factor authentication, password protection, things along that line, regular patching and updating of our software within our systems and our data centers, making sure these things are happening appropriately, conducting threat and risk assessments. That's a whole process where all of the process around data access, use, disclosure, all the technical side of things are actually reviewed. Um, but there's also privacy enhancing technologies, or PETs. And this is probably a term that you've started to hear. It's coming around all the time now. And privacy enhancing technologies are actually this amazing technical safeguard that is sort of having its day, or its time in the limelight. And privacy enhancing technologies, these are the groups, or I guess the set of digital technologies and methods and tools that allow for data processing while protecting the privacy of data subjects. So it allows for the processing that we want, but it's protecting the subjects. And they're used throughout the data lifecycle to facilitate data privacy. And they're really sort of having their heyday right now. And they're not new. This is something you'll be familiar with some of them, but there's been such a recent or a rapid emergence in these pets because of the growing digital ecosystem that we're in, or the data ecosystems. There's just so much data out there now, and there's so much requests for it and access needs for personal and personal health information, with research just being one area that we're requesting access. So we need to balance the things. We need to balance the utility of data with the privacy of data. And that's the value of privacy enhancing technologies. And they're often divided into categories based on sort of how the methods and techniques that are used. And I'll be honest, in preparing for today's talk, I couldn't find consistent definitions. And I think that's part of any new area that's being developed. They're going to sort of, until the language will be all over the place. But the OECD sort of divides the technologies up into data obfuscation, which and these are things or techniques or measures for protecting personal health information by obscuring or masking it. And so we're familiar with anonymization and pseudonymization, synthetic data, differential privacy. These are those kind of tools. Then we have data encryption. This is the type of way of protecting the data by transforming it from its original form and making it unreadable. So it's no longer readable, clearly, legible. So it's encrypted or encoded. And to decode it, we have to have the key. So we do that through homomorphic encryption, multi-party computation, trusted execution environments. And so that's another way. And then we also have federated analytics. And this might be federated learning or distributed analysis. And these are ways of distributing analysis using federated data. So instead of a computation work that instead of actually being performed at one data center and federating that, taking all that data and pulling it all together, and we use the word pooling all the time, the dreaded word pooling, instead of bringing it all to one location where only aggregate findings are examined. And what's so amazing about these technologies and why folks like myself are getting on board and are excited is because it allows for the benefits of data linkage and allows for the research to take place, but it requires less data sharing. And this is always the concern. This is where the risk comes in around privacy. And every time we're disclosing data and sharing data, increases our risk. So how is HDRN Canada involved in this? Well, there actually the network, the data centers, and working groups as a whole, we have a mission and we have goals that all come back to, focusing on facilitating the access to secondary use of administrative data, multi-regional research. This is where we want to go. So how do we enable that with federated data? Well, these pets are giving us that capacity. And so some of the initiatives that have been happening throughout the network are common data model initiatives, projects, the C nodes and the OMOP. So that might be something that you're familiar with. And there's been a lot of work on that throughout the network. Federated learning initiatives. And I'm so excited to talk that this one, I want to say, join us next time and this series, because this is the exciting work that's being done in that area. Lisa and Mahmoud are going to speak about it. And then Federated Analysis State of Science Collective Learning Series. I cannot speak highly enough about this series that was presented in 2024. It was a series of webinars and online resources that spoke to the federated analysis and what's possible and how HDRN as a network is looking into it and starting to understand it and interpret the capacity around this technology. And so as a privacy team, our role is to learn along with everyone else in the network. So we're learning about federated analysis. We're trying to get our heads around it as well at the same time as everyone else. And so part of our work plan for 25, 26 is to actually embrace this as much as we can. So we're starting out with a horizon scan of privacy protection practices and privacy enhancing technologies. What's out there already throughout the network? What else is being used elsewhere, perhaps in throughout Canada and other areas, specifically related to health research, linking of administrative data? That's where we're going with that. Another initiative that we have is we're actually playing a really pivotal role in assisting with a study that's going to be going on in Atlantic Canada, an effort to pull aggregate data together for cross-border sharing in the 4 Atlantic provinces. And really, the question comes down to small cell counts. What does that really mean, and why do we use small cell counts as our determining factor of what gets released and doesn't get released, and how do we share across borders? So we're hoping that from that work that we're quite a central piece in that initiative, that we're hoping that maybe we can start to identify some standards for sharing aggregate data, especially the smaller counts. And then finally, we're here to support the CFI grant. This is a major HDRN Canada initiative, and there's going to be a privacy needs assessment that has to be completed, so we can understand what the privacy needs are going into the future for HDRN Canada. So these are all just 3 things that we have right now on our agenda to help move forward with privacy in the coming year. So, and of course, we're the privacy team. So I would not be able to have this opportunity without talking about Data Privacy Week. Yes, don't forget that January 27th to the 31st is Data Privacy Week, and Privacy Day is January 28th. And for those inquiring minds, it is the 44th Data Privacy Day. And what it is, it's an anniversary of the first of signing of a convention that made the legally binding international, I should say, treaty that was dealing with privacy and data protection. So, and I think that's pretty cool. It came out 44 years ago. Some folks weren't even born then on this call. So that's a pretty amazing achievement. And so we recognize it once a year. And there are some really interesting initiatives that happen in around the Privacy Week. There's global initiatives, the CPDP, which is a European group for computers, privacy, and data protection. And that group actually has a whole day. You can go online. I didn't put the link in this one because I'm not as familiar with that group and I didn't want to necessarily go out of my way to promote it, but I wanted to emphasize that there are international initiatives that are out there. The Privacy Commissioner of Canada actually has some funky backgrounds you can put up for your Zoom meetings to remind folks about privacy. And then there's some really good local initiatives. I'm really impressed with the University of British Columbia. They're actually going to they have some events through, I think, 3 days during the week. The link, we're going to share these slides. They have some interesting pieces around privacy. And each year, the Privacy Week actually has a theme. And so this year, the theme from the Privacy Commissioner of Canada is to put privacy first. And I'm really excited about this theme because that is exactly what we do in HDRN Canada. We are putting privacy first. We do not access data, all the safes that Michelle was talking about, the projects, the safe people, the safe outputs, the safe spaces. This is all about putting privacy first. And that's what's so this is what's so great about this theme. But we also need to remember our own personal privacy. And so I'm going to challenge folks that on January 28th, you take a conscious effort and pick a new privacy practice that you can adopt into sort of your daily routine or into your interactions with your data. How, like, ask yourself like some questions. Like, I don't know about folks. Are you looking at the cookies when they come up and you get those little cookie warnings? Are you just always accepting them? Have a look at them. You can go in and save your preferences and you can turn off the targeting and you can turn off ones that you don't want to have, be using. Revisit your phone settings. When was the last time you actually looked at what's tracking you or who's tracking you? Like, when was the last time you had a look at that? These are things that you can do personally to protect your data, because it's key to how we understand and working with data is to remember that privacy needs to come first. And that's really what Michelle and I wanted to talk about today. We wanted to highlight the advantages of data linking. We wanted to highlight how HDRN Canada is engaged with working with this data, and how we're really making sure that privacy is up front and center, and that we're learning as a privacy team how to help protect privacy as new technologies come about. I have resources added here. And I also have our reference slide. And again, we'll share the slides. So if there's anything here that you're interested in seeing, we're happy to share that with you.